key injuries that we'll tend to see in female soccer players, first and foremost, ACL injuries. Secondly, MCL, or medial collateral injuries. And then, of course, torn meniscus, the cartilage tearing. And then the PCL, the posterior cruciate ligament. So just go back on the ACL, the PCL, we understand they're the ones that take care of things going forward and backwards, right? Whereas you've got two ligaments, one on the inside, one on the outside. You've got the medial collateral ligament on the inside to prevent the knee from going this way. And then you've got the lateral collateral ligament to prevent the knee from going that way. So again, if you think of most of the weight bearing being on the medial side, where do you think we're going to get most injuries? On the medial or the lateral side? The medial side, you got it. So typically what will happen is that these three can make up, if anybody's ever heard of the terrible triad in a knee injury. When you think of the ACL being injured, if there's a tear of the ACL and there's an injury of the MCL and a tear in the meniscus, this is often what happens with a serious rotational type of injury, is all three will tear. And that's what they call the terrible triad. So oftentimes it won't be just an ACL all by itself. It'll be the ACL, it'll be the MCL, and it'll be tearing of the meniscus. And usually when that happens, it's a surgical procedure. There's no getting around that. And then of course the PCL, if things really get taken away, then the PCL gets torn as well. Not very common, luckily. How does somebody injure their ACL? Has anybody ever seen it? We've seen a knee injury tonight. What did you see out there, David?
She planted her heel. She was wearing outdoor cleats,
yep.
sort of blade cleats, which
gotcha.
I hate in here.
Totally.
And so she planted her heel and then turned.
You got it.
So
there's your classic rotational instability that's created. And oftentimes that's exactly what's going to happen. You plant and there's going to be a rotation. There's not a lot of stability when we do that. Now, oftentimes there's also going to be that translation where you're running forward and you go to plant and turn. So your body weight is still going that way, and all of a sudden you're trying to twist. So you can imagine how much stress is going to be on that knee, on the ACL, the MCL, and the meniscus there again. So most of the time, that's exactly what's going to happen in the case of an ACL injury, is that rotational stress, as well as somebody coming in, it could be a hit to the side there as well. But generally, what you're going to see with an ACL is that typical pop feel. Anybody ever felt a pop in their knee with any injuries? Basically, that's going to be the classic type of thing that you're going to hear in an ACL or an MCL or a meniscus type of injury, is that classic pop, and the person's going to go down like a bag of spuds. Basically, what you're going to feel or hear as far as the pop, you think of the synovial fluid in the joint. Within every joint, there's that synovial fluid, which is the fluid that protects bones from rubbing against each other. So in that fluid, there's always lots of CO2 and nitrogen gas bubbles there. So if there's a serious change in the pressure, along with that potential for a tear, there's going to be that pop. Luckily, it's not bone on bone that causes that cracking sound. It's basically gas bubbles in the fluid of the joint that become cavitated with that sudden change in pressure. So that will be a serious pop off, because there's a real sudden change in pressure when that happens with the rotational instability of the knee. And then of course, you're going to have a lot of pain, you're going to have a lot of swelling. Usually the swelling will be very quick, so it comes back to, at that point, rice. Everybody familiar with rice?
Rice compression elevation.
How about price?
What's your price?
Pressure. So basically we get that price going there, but as you can see in tonight's situation there, for example, the swelling is going to be swelling regardless, because there's going to be a lot of things going on as far as neurohormones. There's all kinds of things happening as far as the body going into protective mode. So you're going to get some serious inflammation around that area. And basically, it's a good thing. The inflammation and the pain is there to make sure that person doesn't go back on the field again. Body's got a great way of shutting us down. Pain. It's good that way. So of course, after an ACL injury, David described it to a T there as far as the swelling and the pain. So the best course of treatment, if we think of what happened there tonight, what's the first thing you would generally do if you see all those signs as a coach?
immobilizer.
You have a immobilizer, you've got the price. What's next?
I guess for me, I'd try and figure out what's going on here. Like, I'm probably just gonna see a player go down, and she may be off the ball or out of the play, and I may not even see it, so I
Yep.
just know I've got a player down, so the first thing I have to do is figure out what's the problem.
You got it. So from a coach's standpoint, it's going to be key to understand basically what David's describing is the etiology. You know, what exactly just happened here? Get the lay of the land as to what happened with the injury, because you may have your head down or your turn the other way and something happens. So it's very important to understand exactly what the mechanism of the injury was. And, you know, if you didn't see it, you want to make sure that you recruit anybody that did see it so you have a good understanding of it. Just a very important thing is, you know, the next step may be sending that person to Emerge or, you know, to the doctor's office, and it's always important that, you know, that's going to be the first question that I'm going to be asking is, okay, what's the etiology of the injury? What's the mechanism? How did it happen? So generally, the athlete may be able to describe it themselves, but a lot of the time they're just in the middle of it. They may not even know. So it's important that, you know, the coach or the parent or anybody that's involved knows that mechanism of injury, because it's really going to help when it comes to a person like me trying to diagnose and treat the injury, because usually I'm not standing on the sideline there.